welcome to Simply Women's Health with CJ. Today we're going to talk about endometriosis. This is going to be a two-part video set. Today we'll talk about what causes endometriosis and the symptoms of endometriosis. Part two will address more of the treatment options. So what is endometriosis? The best analogy that I can give to most of my patients is that having endometriosis is like having an eyelash in your eye. It is normal tissue in an abnormal place, which causes a fair amount of discomfort. So endometriosis is basically normal tissue in an abnormal place. So when I have a patient who comes in and I have a suspicion for endometriosis, I will usually draw my very fancy uterus. As always, I am a nurse practitioner. I am not an artist, so I make sure that I give them that disclaimer. So the uterus is basically three different layers. The first layer is the endometrium. That's the section that fills up with blood every month with the endometrial cells that are preparing for a pregnancy. These cells get full of blood, and then when a pregnancy does not occur, the myometrium, the muscular layer of the uterus, will contract, expel these cells out through the vagina, and that is your menstrual cycle. For people who have endometriosis, they don't know exactly why it happens. The most common theory is what's called retrograde flow. So instead of the uterus contracting from the top and pushing down, pushing the endometrial cells out, for whatever reason, these patients, their uterus contracts from the bottom. These cells go out through the fallopian tubes and end up out into the abdominal cavity. So under the influence of normal hormones, because these patients with endometriosis still menstruate on a normal basis, these cells, even though they are out into the abdominal cavity, they don't know, the cells don't know that they're not in the uterus anymore. They just know that their job is to fluff up every month and prepare for a pregnancy. They fluff up, and then under the influence of hormones, they bleed like a normal menstrual cycle. So all of these little cells, they'll bleed, and then the body will form scar tissue or adhesions where the tissue all gets stuck together. So these patients have a lot of pelvic pain. What causes it? Again, retrograde flow is one of the theories. There does appear to be a pretty strong genetic component. So if you have a family history of endometriosis, there's a higher suspicion that you might have it. They're also finding that women who start their menstrual cycles early, prior to the age of 11, they're at greater risk for having endometriosis. Thankfully, there is still ongoing research as to exactly why this happens, and hopefully someday we will have an answer. So what are the symptoms? Some people have no symptoms at all. Some people we find out strictly by accident that they have this. Most women will come in and complain of some kind of pelvic pain, whether the pain is right before the menstrual cycle, if it's mid-month, right around the time of ovulation. Some of these women will have increased pain when they have bowel movements or they urinate. Some women will have pain during sexual intercourse. Again, some people don't have any pain at all. A lot of these women, they will come in and they will have had a difficult time getting pregnant because these cells, they can get onto the fallopian tubes and again, like I said, cause scar tissue, and that scar tissue can make it almost impossible for an egg to get fertilized. A lot of these women have been to the emergency room because of their pelvic pain, the abdominal pain that's caused by all this scar tissue. And they have had a pelvic pain workup. They look for various infections. They may have had pelvic ultrasounds, and that doesn't reveal anything because unfortunately, you really cannot see endometriosis on a pelvic ultrasound. They may have even had x-rays that revealed absolutely nothing. So a lot of these women come in and they are quite, they're frustrated because they know that they're in pain, and they feel like the medical establishment has basically just told them it's nothing and it's normal, and a lot of these women have even been referred for psych evaluations, and they truly are in pain. So what is endometriosis? How is it diagnosed? When you come into the clinic and you're presenting with pelvic pain, and your provider will likely do a pelvic pain workup, ruling out infection. They will do an ultrasound just to take a look inside. The only true way to diagnose endometriosis is via laparoscopic surgery. That's where the surgeon will go into your belly button. They will make a couple of different incisions on your abdomen, and they will go in, look around with a camera, and see if they can find scar tissue that's indicative of endometriosis. I'm going to be honest, most providers are hesitant to do that. It's very invasive and it's not without risk. So most will diagnose you based on just your symptoms alone. Your provider will want a good history. When did this pain start? Do you have family members who have endometriosis? What is your pain cycle like? And what do you do to alleviate your pain? You're going to want to know all of that. Sometimes endometriosis can be diagnosed via what's called an endometrioma. Endometrioma is basically a cyst that is in the ovary that has gotten filled with the blood from these endometrial cells. The blood turns brown, and if they remove these cysts, they leak out all this blood, this old blood, and so these endometriomas you'll also hear referred to as chocolate cysts. So if you go and they do an ultrasound and they have a suspicion that you might have what's called an endometrioma, your provider may order an MRI for closer evaluation, or they may just go ahead and make the call, and especially based on any other symptoms that you have, and diagnose you with endometriosis. So what are you going to do about it? That is very dependent on how invasive your endometriosis is. The provider that you have is going to offer you various treatment options, and that's something we will discuss in the next video. If you think that you might have endometriosis, I'm going to strongly recommend that you make an appointment to see your gynecological provider. I'm not your provider, I am a provider, but my purpose in doing these videos is not to replace a visit with your doctor, but rather to give you information so that when you do meet with them, you have a better idea of what questions to ask to best optimize your own healthcare needs. If you feel as though these videos have helped, please feel free to subscribe, like, share, whatever you feel compelled to do. And I will leave my email address in the comments section. If you have questions and would like to reach out to me, please feel free to do so. This is it for today. This is CJ at your cervix.